Bezans Healthcare apresenta Mulher PODcast, o seu podcast de saúde feminina, de médico para médico.
Sejam bem-vindos ao Mulher PODcast, o podcast da saúde feminina para os médicos. Meu nome é Dr. Luiz Steffen, sou ginecologista e sou diretor médico da Bezans Healthcare. Nesse episódio, hoje nós vamos conversar com o Dr. Ludwig Kissel, um renomado médico especializado em ginecologia e endocrinologia. Ele é alemão, possui um extenso currículo acadêmico, tendo estudado na Universidade Ruprecht-Karl, da Escola de Medicina de Heidelberg, na Alemanha, e no Royal Free Hospital Medical School de Londres, e, além disso, realizou pesquisa no Instituto Nacional de Saúde em Bethesda, em Maryland, nos Estados Unidos. Ele é reconhecido pela sua contribuição significativa para o campo da ginecologia e endocrinologia, com mais de 800 publicações, ocupando cargos de liderança, incluindo a presidência da Sociedade Alemã de Endocrinologia Ginecológica e Distúrbios da Fertilidade, da Sociedade Alemã de Menopausa. Foi presidente também da Fundação Alemã de Pesquisa em Endometriose e é membro do Conselho da Sociedade Alemã de Obstetrícia e Ginecologia, bem como das Sociedades Conjuntas de Medicina Reprodutiva. É muita coisa. E, ao longo da sua carreira, o Dr. Ludwig recebeu vários prêmios por sua pesquisa, incluindo o reconhecimento da Sociedade Alemã de Pesquisa em Endometriose, Sociedade Alemã de Ginecologia e Obstetrícia, do Instituto Nacional de Saúde, da Sociedade Alemã de Endocrinologia e da Sociedade Japonesa de Farmacologia. Essa experiência bastante vasta do professor Ludwig e o seu conhecimento fazem dele, portanto, uma autoridade bastante respeitado na saúde feminina. Professor Ludwig, please, your introduction.
Well, first of all, thanks very much for inviting me to this meeting, and I'm very pleased that I can be here in Brazil. I am from Germany, as you've heard, and I'm focusing mostly on hormone action and use of hormones in many contexts. Menopause is a major one, but also other things, endometriosis and also mechanisms of action in breast and breast cancer. Apart from that, I do a number of surgeries in different fields, so I take care also of patients with different ages and can help in our societies to direct research and treatment, just as it is done here in Brazil. And my main interest is to focus on the use of hormones, and the problem is, of course, that there is a lack of knowledge, especially during education. So I think we need to understand more on this action to get the right treatment.
Okay, so let's start with some questions then. We know that vasomotor symptoms, they compromise the patient's quality of life. But we know also that at some point there's a trend for the symptoms to diminish, to disappear, even to disappear. On the other hand, symptoms associated with genitourinary syndrome, vaginal atrophy, they persist for many years and they even worse. The VIVA study, the VIVA international study, they draws the attention to the fact that there is a very high percentage of women that do not receive the diagnosis of vaginal atrophy or genitourinary syndrome. What do you attribute this fact? What is happening?
Yeah, I think this is that's an interesting point, because, as you said, with vasomotor symptoms, which occurs suddenly and it's very obvious, even other people can sometimes see it. So I think this is something which is a total different category than, for example, genitourinary syndrome, which is gradually increasing and it goes slowly, and doctors and And sometimes patients don't realize, because it's so stepwise, that they have a problem. And some doctors even believe, just as patients, that that is normal with aging. And part of it may be, but in general, the hormone dependence of these organs are essential. So it's the vaginal, it's even also the vulvar changes, but also the bladder and some bladder functions. So patients need to be advised during exams or even in taking a history and talking to patients if they have their problems. Often they don't tell this problem, so doctors have to tell them that this is something you can treat, and it's easily treatable, and it can be treated without any major side effects. So I think this is something where patients can be told that they don't need to be afraid of any kind of side effects which may hinder their use. So easily vaginal application of creams and so on are very helpful to treat those patients. And the important fact is that the doctors actually tell them that they have that problem. And many women do actually develop it, but many of them actually don't know that you can easily do something for it.
Yeah. Maybe this would that have, as you mentioned, you can use hormonal locally, but do the patients, are they afraid of using hormones locally too?
Yeah, actually, anything when you say it's hormones, they have been, I think this fear is triggered by a lot of publications by the local press, etc., not necessarily just the scientific press. So anything you suggest which contains hormones would be very looked at critically, although that's the problem what the patients have. They don't produce hormones anymore in sufficient amount, so they need to have it. Even patients who take, let's say, transdermal hormones, sometimes they need additional vaginal treatment. So patients have to be aware that this is something treatable and it's normal. And that's why I think they should be told that the risks which are generally discussed is just not justified and they are not present. So especially women who have symptoms, but also who have changes in their vagina or problems with the bladder, they can be treated. And that's what doctors need to tell them and prescribe adequate treatments.
Okay. And this one is maybe the $1 million question, you know. Considering the treatment of patients, considering the persistence and worsening of symptoms of the genitourinary syndrome over the years, compliance to the treatment is crucial. How do you advise your patients?
Well, I think there are two problems to that question. One is patients who have a sufficient response to the hormone treatment. They believe that if it's okay, then can they stop the treatment, which obviously is not the case, because the positive effect is only because they use the drug. They have to keep using it because they don't produce hormones anymore. And that's one thing. And the second part is initial effects are very good, especially if the vagina is quite thin. But as soon as the effect is better, the effect of the cream actually diminishes a little bit. So you actually have to adjust to it. And that's the second point, which doctors have to understand, that absorption was actually extremely good in the beginning. So patients will have good effect, and they need to persist and use the treatment in order to have that effect.
Okay. Dr. Ludwig, we know that the individualization of treatment is essential in medicine overall. So considering this, how do you approach the issue of personalizing relief for symptoms of genitourinary menopausal syndrome? For example, Are there specific factors you consider? I think some points you consider in the last answer, but are there specific factors that you consider when deciding what the type and dose of hormones you prescribe? For example, here in Brazil, you mentioned the cream, but you have creams and tablets. So patients may have a preference for better use, cleaner, or what are the factors that you consider for the treatment?
Yeah, obviously there's a wide range of what patients expect from the treatment. I think, first of all, when doctors do the exam and see typical changes of vaginal atrophy, that should be mentioned to patients. Mm-hmm. And the second point is if patients have more problems with bladder function, I think that should be also discussed with patients. And something patients not necessarily will tell you in the beginning. They don't come necessarily because of these problems.
I read a paper, I think it was a poster presented by Simon many years ago, that in this poster he said that physicians don't ask, patients don't talk. So,
yes. And that's quite true.
Yeah.
I know Jim Simon, he put it totally right, because that's not something you like to talk about. I mean, these are basically internationally everywhere the same, that you don't mention it, and if doctors don't ask because the doctors don't think it is so important. Mm-hmm. And I think these aspects in these patients are very important, and since patients don't mention it, as you said, that's why I think doctors have an obligation to mention it and ask and tell the different options and the benefits, and tell patients that they should not need any fear of using it because of any risks.
Okay. And we understand that the regular monitoring of these patients is crucial when you are prescribing systemic hormones. Could you explain the importance of monitoring to assess the effectiveness of treatment and to ensure patient safety? What specific parameters should doctors look during this process?
Genitourinary?
Genitourinary or even systemic. Yeah.
I think it's very important, especially in the beginning. I often see patients on a regular basis, not just prescribe it and then tell them to come back if they are a problem. Often patients are non-compliant because of reasons they attribute to treatment, but in reality, it often is not unrelated. So they would stop it, or as I said before, they will stop it because they have already an effect, but don't realize that this effect needs to be treated further on. So monitoring is the twofold. One is asking patients how they feel, and especially about their fear. Mm-hmm. Since doctors, they understand obviously more about the endocrine effects, but patients sometimes don't know these details. Mm-hmm. So we specifically have to ask, are you happy with the treatment? Are you have any further questions? And these are point number one. Second is checking on different aspects, for example, in the genitourinary problem, but also in different other effects to see what the benefits. Often patients have a lot of benefits, but they will talk only about some potential side effects, mm-hmm. but forget about the rest, which they actually are very happy about. So sometimes it's 1 out of 10 makes life for them more complicated, although 9 out of 10 problems have been already solved. So I think we have to help patients to balance these benefits and potential questions they have. So there need to be further follow-up.
Okay. So it's not only a lab test, it's not only the mammography, it's more than that.
Yeah, obviously that's different countries have different things. We don't usually monitor endocrine effects. Mm-hmm. We are more interested in what patients actually feel like. It may be different with certain specific problems. It could be bone health, which can be checked by bone densitometry or keep a regular breast mammographies. And I think that's obvious. You need to do that and carry on. And I think if patients know that they are checked and they lose fear about something happening which nobody notices. So if they keep on coming and do these regular checkups, they feel more comfortable. And what we don't usually do is do all kinds of lab tests to check on the effect of the hormones itself or of the levels, because they are so individually different how much when women feel comfortable about it, that we don't rely, just in exceptions, on any lab tests.
Okay. What words would you like to leave for Brazilian colleagues to feel empowered in managing menopause?
Yeah, I think one have to see menopause as a very broad aspect and very broad questions women have. And I think it can be extremely complex. So one has to take time in order to go through different questions what patients already have. But our job is also to look at certain aspects what patients don't realize can be treated today, or maybe even they have fears of not using it and have nobody to talk to. And we have done studies about these wishes of patients on a large scale, and it's quite surprising how much need there is. So we should be able to fill in this lack of knowledge and also the need of patients to get more information. And that's almost most people I know actually, and menopause women have that desire to get more information on that.
Ok. Com essa última pergunta, então, chegamos ao final de mais um episódio do Mulher PODcast. Eu gostaria de agradecer novamente a presença do Dr. Ludwig e aos nossos ouvintes por estarem em mais um episódio conosco. Final words, Professor Ludwig.
Yeah, I think it's an important point, especially on the topic we've been talking about today, that doctors tell patients that in symptoms which occur with aging, not necessarily are something should be accepted just because they are there. And especially because life expectancy is something totally different than it used to be, and the need of patients are totally different than in many years ago. So quality of life is essential in the functioning of women in that period. So as doctors, we need to understand these important questions, and I believe with your help, we will be able to treat these women with these wishes.
Ok. Esperamos que tenham gostado e até breve.